Hello, and welcome to our Candid Conversations on Health webinar series. Throughout the year, please join us as we tackle a variety of topics related to our health and wellness. The focus of today's webinar is pediatric dental health. According to the Centers for Disease Control and Prevention, oral health affects our ability to eat, speak, smile, and show emotions. Oral health also can affect a person's self-esteem, school performance, and attendance at work or school. Oral diseases, which range from cavities and gum disease to oral cancer, can cause pain and disability for millions of Americans and cost taxpayers billions of dollars each year. My name is Ayana Usuri, and I am the support coordinator for the Louisiana Department of Health's Bureau of Community Partnerships and Health Equity. The Bureau of Community Partnerships and Health Equity is devoted to increasing the citizens of Louisiana's knowledge about what affects our health, especially for those in particularly vulnerable communities and populations. This devotion is rooted in raising awareness through webinars like today's and partnering with stakeholders in the community to move toward a healthier Louisiana. Here's an overview of today's event. February is Pediatric Dental Health Month, so we will begin with a brief intro and our facts. Then we'll have our welcome, our panel discussion, and we'll go over some key takeaways. All right, so as far as the facts related to pediatric dental health, so it's good to get information, so get up to date and accurate information from credible sources related to good dental hygiene. Regarding screening, go to the dentist for routine cleanings regularly. Prevention, understanding how the choices we make regarding adequately cleaning our teeth, what we eat, and more affect our dental and overall health, as well as focusing on what we do as children and how that affects our long-term health throughout our lives. Oral health is essential to general health and well-being for all ages. These 4 facts are ones you will hear throughout the webinar. I want to stress the importance of getting information from trustworthy sources. So if you're going to share pediatric dental health information with loved ones or within your communities, please use only information coming from websites like the Louisiana Department of Health, the CDC, or your own trained healthcare professional. We will also provide you with a one-pager via email after this event to aid you in how to share pediatric dental health information. Sharing accurate information can help save lives. And now it is my pleasure to introduce the Director of the Bureau of Community Partnerships and Health Equity, Devondra Brown, to provide a brief welcome and introduce our moderator for today's discussion. Mrs. Brown?
Thank you, Ayana, and thank you all for joining our Candid Conversations on Health Pediatric Dental Health webinar. As you know, celebrations have ramped up during this Black History Month and as we step into the final weekend of the much-awaited return of Mardi Gras. However, we want to acknowledge the many disparities that have been exacerbated by COVID-19 over the last few years. While the need of racial equity is forever at the forefront, we would be remiss to not discuss how gender, class, and urban versus rural residential settings also impact health equity, as you will hear tonight. According to America's Health Rankings, Louisiana's percentage of children ages 1 through 17 who had 1 or more preventative dental care visits during the past 12 months has decreased almost 10% between 2017 and 2020. We can only imagine what the pandemic has done to increase that decline. This health disparity must and will be addressed by our esteemed panel of professionals tonight. So on behalf of Secretary Phillips and the Louisiana Department of Health, I welcome you to tonight's webinar. Before I turn the session over to our event moderator, I want to thank each and every one of you for joining today's conversation. I hope that you find today's discussion informative and helpful. So without further ado, today's moderator is Dr. Bradley Comeaux. Dr. Bradley Comeaux completed his dental training at Louisiana State University School of Dentistry in New Orleans. Dr. Comeaux completed a 1-year residency in general dentistry at LSU School of Dentistry. He then went on to complete a 2-year residency in pediatric dentistry at LSU and Children's Hospital in New Orleans. Dr. Comeaux has been involved in several research projects, all aimed at the improvement of materials used in dentistry. Dr. Comeaux is a board-certified pediatric dentist of the American Academy of Pediatric Dentists and active member of the American Association of Pediatric Dentistry, American Dental Association, Louisiana Dental Association, and the Southwestern Society of Pediatric Dentistry. He is an active lecturer in the surrounding area. To remain up to date on the latest technologies and philosophies, Dr. Comeaux continually attends seminars and lectures. He was born and raised in Baton Rouge, Louisiana, and is married to Dr. Paige Sigsworth, who is from the New Orleans area. Together, they enjoy the practice of pediatric dentistry, and in his spare time, Dr. Comeaux enjoys golfing and is an avid sports fan of the LSU Tigers. So with that, let's get ready to have a discussion. Please, Dr. Comeaux, the stage is yours.
Well, thank you, Ms. Brown and Ms. Ussery, for starting the event tonight. For each of you, the community members and the stakeholders who took the time out of your busy schedules to attend this important discussion, thank you very much. In tonight's webinar, our hope is that what you hear you'll find useful, empowering, and encouraging. We have some trusted gatekeepers from around the state who will lead in our discussion this evening. Before we get started, I would love to introduce our 4 panelists tonight and give you a quick background on each of those. First, we have Dr. Kredenna Beverly. She is a board-certified diplomate of the American Board of Pediatric Dentistry, and she's the owner of Twinkling Smiles in Baton Rouge. She's part owner of Twinkling Smiles in Oakdale with her twin sister, Kredenna Beverly. Dr. Beverly is Baton Rouge native, and she completed her collegiate and research studies at Southern University A&M College. For her dental education and her residency was at Howard University College and College of Dentistry in Washington, D.C. Recent awards received include the Southern University Alumni Federation 40 Under 40 Award and the Delta Sigma Theta Sorority. The Louisiana Statewide Summit Delta Women of Excellence in Business Award. Dr. Beverly is committed to delivering the highest standard of exceptional pediatric dental care, increasing pediatric dental access, serving the underserved, and to improve the oral dental health awareness and education in Louisiana. It's a mouthful. Next, we have Dr. Suzanne Fournier, who is originally from Miami, Florida, and received her bachelor's in biology and in history from Rhodes College. She attended the University of Michigan for dental school and got her certificate in pediatric dentistry from the University of Florida. She was an awardee of the National Health Service Corp Loan Repayment Program and served 6 years in community health care before serving 6 years as the postgrad program director and 15 months as the interim chair of LSU Department of Pediatric Dentistry. In September of 2020, she joined the Children's Hospital of New Orleans as a full-time hospital-based pediatric dentist. There, she participates in multidisciplinary care teams such as the craniofacial team, safe trach team, and she works closely with other services such as the vascular anomalies, hematology oncology, and cardiology. Additionally, for the past 7 years, she has served as a Louisiana public policy advocate for the American Academy of Pediatric Dentistry. Next up, we have Dr. Alexis Russell, who's also known as Dr. Lex, and she is practicing pediatric dentistry in the New Orleans area. She, along with her husband, Dr. William Shelton, are the owners of Tulane Family Dentistry. This is a full-service dental practice that treats patients of all ages. Dr. Lex is a graduate of Xavier University in Louisiana and received her Doctor of Dental Surgery degree from Howard University. She completed her specialty training in pediatric dentistry at the University of Las Vegas, Nevada, where she conducted her research on the relationship between ADHD and sleep disturbances. She is well-versed in the most current technology and techniques in behavioral management, conscious sedation, aesthetic pediatric dentistry, and trauma management. Dr. Lex is very passionate about children and prioritizes her patients' comfortability while in and out of the dental chair. Her guiding initiative is dental education, and she works to ensure that every patient and parent is informed about their oral and overall health. Dr. Lex is a board certified member for Breakthrough NOLA and a member of the American Academy of Pediatric Dentistry and American Dental Association. In her spare time, she enjoys spending precious moments with her husband and her 4 beautiful children. Lastly, we have Dr. Sancerie O'Rourke-Allen, who was raised in Baton Rouge and envisioned being a dentist since the 7th grade. In 1994, she graduated from Xavier University of Louisiana with a bachelor's degree in chemistry. She then promptly entered Baylor College of Dentistry in Dallas, where she earned a Doctor of Dental Surgery degree in 1998. After completing an advanced education in general dentistry residency at the University of Mississippi School of Dentistry, Dr. O'Rourke-Allen came back to us here in Baton Rouge. She's always focused on the community. Dr. O'Rourke-Allen practiced dentistry in the public health sector for over 10 years. She enjoys working with the mentally challenged and all of her patients. In 2006, Dr. O'Rourke-Allen opened her private practice, Distinctive Smiles of Baton Rouge, and she maintains membership in several professional organizations, including the American Dental Association, the Academy of General Dentistry, the Louisiana Dental Association, the American Orthodontic Society, Continuing Dental Education of Baton Rouge, and the Capital City Dental Association. She's a past president of Louisiana Academy of General Dentistry and the Pelican State Dental Association. In 2005, she was selected to participate in the American Dental Association Institute for Diversity and Leadership. There are only 12 dentists that are selected throughout the nationwide application pool to participate in this program. In 2011, she received her fellowship in the Academy of General Dentistry. In 2015, Dr. O'Rourke-Allen was the only dentist from Louisiana to receive her mastership in the AGD. She is married to Demetrius Allen and has 1 son, Donovan. These are our panelists this evening, and I think as you can clearly hear, they are very distinguished and well-knowledged. They're going to help us to have a brief but deeper discussion as we continue to remain vigilant in the fight against diseases that affect our health and the wellness while pursuing a healthier Louisiana. Tonight's discussion will be factual, based in science and understanding. And let me be first to say, as the moderator of this session, that people have a right to feel what they feel regarding their past and present experiences of racism, sexism, mistreatment, or injustice. We know these experiences play a part in people, populations, and communities' trust in the healthcare system. So let's get started with the discussion this evening. First question that we're going to ask is really for whoever wants to answer this one. This is kind of a get us started question. And it's going to be, how is a pediatric dentist different than a general dentist? So whoever wants to jump in, feel free.
Well, I guess I can take that one since I think I may be the only general dentist on the panel. Basically, as I tell people, as a general dentist, I see all ages from birth to death. I see, and I do what I want to do within the scope of dentistry. So I enjoy seeing children just as much as I enjoy seeing my geriatric patients. So I think that is more or less, I usually get the patients from the pediatric dentist when they get their big teeth.
Very good. Anyone else, one of our pediatric dentists, have any input? Dr. Fournier?
Sure, I'll take that. As a pediatric dentist, especially one that works in a hospital setting, pediatric dentists do typically 2, sometimes 3, depending on the program, years extra training to learn specifically how to work with patients with special healthcare needs, but also we specialize in growth and development, trauma management, like I know Dr. Russell mentioned, or you mentioned about Dr. Russell, as well as so growth and development, trauma management, special healthcare needs, behavior management, and specifically pharmacologic behavior management, including oral conscious sedation and working, especially like what I was doing today, working in the operating room and being able to manage medically complex patients in kind of non-traditional settings.
Very good. Anyone else? We're ready? All right, well, let's get started with some good questions. And Dr. Beverly, you're going to be the one to start us off tonight. So first questions I'm going to have for you. When is the best time to start brushing your child's teeth? And how many times a day should children brush their teeth?
Yes, I'd like to start off by thanking the Louisiana Department of Health for having us. And thank you, Dr. Comeaux, for giving me the easiest question of the night. And the best question, and that question is simply when the tooth first erupts. That's when you start brushing. However, the tooth doesn't start to erupt on most kids until about 6 months, but we do need to do gum care before then. And that gum care involves just wiping the gums with a moist cloth, just keeping it clean until those teeth do erupt. And once they do, let's get our little baby infant brush, soft bristles, and brush twice a day.
Very good, thank you. Next, Dr. Fournier, you get to have a turn now. And we're gonna kind of keep up with this preventive theme. So the question for you, when should parents schedule their child's first dental checkup?
So going along with what Dr. Beverly said, our American Academy of Pediatric Dentistry guidelines recommend having the first dental visit when the first tooth erupts, or at the latest by the first birthday. And the reason why is because we would much rather prevent problems than have to treat them. Those first visits are oftentimes more talking and counseling and demonstrating than it is doing any sort of cleaning. We do typically what we call a knee-to-knee exam. So we will do an examination and clean the teeth, but cleaning a 1-year-old's teeth is a little bit easier than when kids get a little bit older. So in general, we'd much rather prevent problems than have to treat them later. So that's why we like early preventive visits.
Well, with that fantastic answer, you just segued yourself into another question. So we're going to stick with you and ask, why is preventive care so important?
Sure. So an ounce of prevention is worth a pound of anything else in my book. So I think it's important to take a step back and talk for a minute, if it's okay, about how people get cavities. Most people are not aware that what we call caries, it's a dynamic process, and it is considered an infectious disease, which means that it's transmissible. So the bacteria that cause cavities can spread typically through saliva contact. And that's why we like those early dental visits, because it's important for young parents, especially before kids' teeth erupt, to get their teeth taken care of. That's where I know Dr. O'Rourke-Allen will really do well to help manage the whole family. But if we can hopefully prevent the spread of the bacteria, and again, it spreads through saliva contact. So like blowing on food to cool things off, sharing drinks, sharing spoons, talking about not putting a pacifier in a parent's mouth and then giving it to the baby to clean it off, because it's actually going to cause more problems than anything. That will hopefully help in terms of long-term. Plus, we like to help establish healthy habits early in terms of diets and oral hygiene. And honestly, for me, I find diet to be the most important in terms of prevention. And what's good for the teeth is going to be good for the body. And drinking more water through the day, as opposed to sipping on juices, will not only help prevent problems with your teeth, but also can hopefully help prevent problems with issues like childhood obesity and type 2 diabetes as kids grow. So that's my sweet and condensed answer.
Lovely information. Dr. Beverly, I'm going to come back to you kind of on these same lines. So what are some of the things at homes that families can do to include effective morning and evening cleaning routines?
So effective cleaning routine is basically, first of all, start by doing it every single day. Morning and night, brush twice a day. In that effective routine, parents can do it with their children. Show them how to do it. Make sure that they are doing it and doing it correctly. You're doing it also the 2 minutes. Once you do your brushing, make sure you're doing great brush technique, 45-degree angles, the small circles, making sure you're getting all surfaces of the teeth. Then we brush our tongue, make sure our gums, we can rinse. Make sure we also include the flossing. That is so important. Parents tend to think that flossing, you don't have to start that until you get your adult teeth. No, we have to start a little bit younger, much younger. Whenever those teeth are touching, as I tell parents, whenever the teeth are touching, we have to make sure they're clean in between there. And so you could consider rinsing if you want to. I tell some parents, let's focus on brushing, then we could jump to rinsing. And the main thing is just twice a day. 2 minutes.
Perfect. All right, Dr. Russell, your turn to get involved in the action. Are baby teeth important for child's development, and how so?
Yes, they're absolutely important for a child's development. First of all, baby teeth act as natural space maintainers for the adult teeth that are underneath them. So if you lose a baby tooth prematurely, you increase the potential for crowding or impaction of adult teeth in the bone. So essentially those adult teeth would be staying in the bone and they don't have anywhere to erupt or any space to erupt into. So I know my first thing I'm trying to do every time is trying to save that baby tooth. And that starts with prevention, and that starts with getting guidance at an early age, like Dr. Beverly and Dr. Fournier stated. In addition to that, the baby teeth are important for bone growth and arch development. So again, if you lose that baby tooth earlier, essentially, if you're not using it or using anything in that space, the bone kind of recesses. So we need those baby teeth there for that bone to stay there, to allow that adult tooth to erupt into that bone. And it's just important. You want to prevent these issues early. You want to prevent, again, if you lose a baby tooth early, you may increase your costs later by needing surgery to try to get an adult tooth out, or, orthodontic care. So super important.
Terrific. Dr. O'Rourke-Allen, so for you now, what are some of the risk factors for developing cavities that you see?
So I see familial history is always very important. If you have if your parents didn't have teeth at the age of 40, then, we need to figure out why and what we can do to prevent that. You have dry mouth. Dry mouth syndrome is a big risk factor. And that can be from medications, antidepressants, high blood pressure medicines. Sjogren's syndrome would be a condition which you could lead to dry mouth as well. Really, a great factor is just the sugary intake. A lot of these kids, particularly kids, but young adults as well, tend to drink a lot of Gatorade, Powerade, sweet tea is a big, and Coke. And quite frankly, I tell that's just like just drinking sugar. It is a pound of sugar and it sits on your all day. And so, of course, we have so many people who do not brush at night, which is a critical time because that is when you have decreased saliva production. So the chance of you getting the cavities is increased. That on top of the fact, like Dr. Beverly said, if you're not flossing, if you're not flossing and you have all of this sugar content just sitting on your teeth, it's like I tell them, it's no different than you taking a shower and not raising your arms. You will still be funky. So your tooth is still not going to be clean because you did not floss and get the entire surface of the tooth.
And just to add a little bit what Dr. O'Rourke-Allen was saying, though all those things are correct. As pediatric dentists, we have a thing that's called the caries risk assessment. And we actually go down that sheet and we check it off and we discuss each one with the parent. So with this sheet, you see that, okay, I have too many of them versus just a couple of them. So I am more at risk. Sometimes you have to just put it on paper for them. Another thing to add to the caries risk assessment, if I have a parent that comes in with, let's say 4 children, and the first 2, a mouthful of cavities, what can I expect from the rest of the family? And we have that conversation too. And it's one of my greatest moments when at least maybe when I get to that last one, we're caries free, at least the time they're with me throughout their childhood. But also to siblings. Siblings in our practice is a great indicator. Also, visibility of plaque, calculus on the teeth. Those are some of those other things, along with what Dr. O'Rourke says, that will be found in those caries risk assessments.
And if I can add on to what Dr. O'Rourke-Allen was saying about diet, For me, it's not so much how much sugar, but it's frequency throughout the day. It's the kids that are constantly sipping on things, especially sippy cups that have things other than waters. When kids take a sip, they put it down, they go play, they come back, they take a sip, they put it down, they go play, they come back, they take a sip, they put it down, they go play, come back, and they're constantly sipping on things throughout the day. That will absolutely put them at a higher risk than the ones that are drinking a juice at breakfast once a week. So for me, I always like to talk about just the frequency of sugar consumption. And like Dr. O'Rourke-Allen was talking about with sodas, especially in juices, that the bacteria that cause the cavities thrive in an acidic environment. So a lot of times people think, oh, I'm using, the little Mios or, flavor packets, and it's going to be okay because there's no sugars in it. Or I'm drinking diet sodas because they don't have sugars in it. They're still extremely acidic. And even some bottled waters are extremely acidic and have pHs of like 4.7, which is like, I don't know why. But I always like to look into water fluoridation and access to fluoride as well in terms of caries risk assessments.
So docs, as the non-doctor, I actually as a parent want to just ask this question. And I have big kids now, but just for even the babies, right? You're saying these sippy cups, we know that those sweet drinks pacify them, especially if that's the first thing that they got, right? They immediately went to juices and juice boxes and all. Is it okay? Because I remember hearing this. Is it okay to just dilute it with water? Is that better?
So
than
it's a little bit better. However, here's the thing. You still want to keep it to about 4 ounces total and just at meal times. Because what happens is if, say, you're diluting it, you're actually increasing the volume, which will then increase the amount of time throughout the day that people are going to be sipping on it. And there's still a lot of sugars. And the bacteria that cause cavities will take the sugar and produce acid. I usually, when I talk about cavities and how kids get cavities to kids, I explain that the bacteria that cause cavities make the same acid that your muscles make in your legs when you run really fast. And I usually ask kids, when you run, you got to stop and you breathe and you're like, and then you feel better. Well, the problem is the bacteria don't have lungs like we do. So instead they can't breathe. So for them, it's like they go poop on our teeth. And kids usually don't want sugar bugs pooping on their teeth. So.
But also, I have one more thing to add to that. In addition to the liquid that Dr. Fournier is talking about, it's high carbohydrate snacks as well. And they're eating that in increased frequency throughout the day as well. So I always recommend that children are eating at a table, a snack at a table, instead of being a grazing snacker, picking up the snack and walking around with it and picking up the snack, kind of like what she was explaining with the juice.
Exactly.
So, and in smaller portions as well, and being intentional about the snacks that our children are eating. So not always, like I said, those high carb snacks like crackers and cookies and chips. Yeah, so let's change up those snacks a little bit.
Gummies.
Well, and when they eat those crackers and chips and things that are more salty, they get thirsty. And then they're going to drink more, and then they're going to have more juices. And so it's the self-perpetuating cycle that will cause more cavities in the future. So yeah, we usually like to recommend more protein-based snacks, things like cheese, yogurt, nuts, nut butters, as long as there's no allergies, eggs, beans, any kind of protein-based snack. And that will also help extend their blood sugar level longer, so they're not going to feel that need to snack quite as often.
Yes, and I to piggyback on that a little bit, and I always tell the parents too, I know this is childhood. I know, and let's be human and let's, live in today. A kid will eat a bag of chips and they will get a piece of candy. However, let's just do moderation. That's common sense. If we just moderation and we do our proper oral hygiene, we're probably going to be in an okay spot.
Well, you know what I tell them, right? Oh no, I was just going to say, I just tell them, I tell the parent, the child doesn't work. So the child is not buying all of the sugary snacks. You are. So if there are no sugary snacks for the child to get up in the middle of the night to eat, you're right. There are other options that the child will get. Maybe the child will eat a banana versus the gummy bears.
Mm-hmm.
And I always say, follow it up with some water.
Right.
Just wash it down, increase that frequency of water throughout the day. You can eat those snacks, but we need to drink some water behind that.
And Moderation.
Absolutely.
Great tips, great tips. Well, since y'all went ahead and changed the topic and made this a little macabre with cavities, now, Dr. O'Rourke, let's go back to you. What are cavities and how are they caused?
So cavities is as basic as we can get are holes in your teeth. And basically it's just a breakdown because that bacteria that's in your mouth, it meets the food particles or those sugary substances. And like Dr. Fournier said, it produces this acid. And then it ends up creating these holes in your teeth. And it depends on where it's located. It can be on the smooth surface of the tooth. It can be pit and fissures, or it could be root caries. Don't see as many root caries in my pediatric patients, thankfully, but in a lot of our geriatric patients, basically when they have receding gums, then it makes the root surface present, and it's therefore a little bit more susceptible to cavities.
Very
good. Did I answer your whole question? I'm sorry.
Yes, that was great. Dr. Russell, let's see, why is it important not to wait until a child's experiencing any physical pain to see the dentist?
Well, first of all, as a parent, I never want to see my child in pain nor any other children. So as a parent, I would not want to wait to see my child, or like I said, any child in physical pain. But that's where prevention is key. Physical pain means that the tooth is now telling you something. It's telling you we need to do something, right? So bringing your child in for those preventative appointments, and if we're seeing, or if I'm telling the parent that there's what we call like an incipient lesion or something small going on, that means we need to change diet or increase hygiene practices or adjust something so that the child is not experiencing that pain. Just because the child isn't experiencing pain doesn't mean something doesn't need to be done about it. We need to do something preventative and make some sort of effort so that our child doesn't experience that pain. And in addition to that, if there is pain, that means the severity of the treatment increases, which means the cost of the treatment increases. So it is important to address it while it is small and is not an issue versus waiting until there is an issue, which may increase the incidence of behavior issues as well. Because now you're bringing the child to the practice or to the office to treat something that is now bothering them. And they're always going to equate a negative experience, a potentially negative experience or a negative feeling with the dental office. So you're just setting them up, or you're setting your child up completely if we're not addressing it or addressing these smaller issues or they're not really, a big issue. So
just to add on what you said, waiting for pain, now we could potentially be at extractions or crowns and nerve treatments versus a cleaning and a sealant. So pain, we have big problems then, big problems. Let's start when there isn't a problem.
Great. So sticking with that, Dr. O'Rourke-Allen, is pain or sensitivity in the mouth the only indicators of tooth infection or decay? And what are some common signs of decay?
No, you could have staining, a different change in the color of the tooth, a change in the surface area of the tooth. Sometimes I always say white spots are definitely not healthy spots. There are areas for potential that have the ability to soften quickly and then end up having to be treated. Yeah, definitely.
So I heard someone mention just a second ago about dental sealants. I think that was you, Dr. Beverly. What are sealants?
Sealants is a preventive measure which is placed on molars of children, usually the age of around 6 to 8. And we know that the occlusal surface is the top surface of those 6-year molars on children. That's the most common cavity that people receive over their lifetime. So if we can place a sealant, and it's a resin that flows in the grooves of the teeth to help seal out decay. I tell the kids it's like I'm putting nail polish on. But it's tooth polish that's going to stay to protect your teeth. And it's just a preventive measure that has been shown to be very effective in decreasing the amount of decay on those particular teeth. And we do sealants on the 6-year molars, then you get your next set at 12 years on your 12-year molars. And we normally don't seal your 15 molars, your wisdom teeth. We don't usually fool with those.
Very good. And then Dr. Beverly, we'll stick with you. How often should parents schedule checkups for their children?
Oh, you gave me another easy one, twice a year. My favorite, number 2. And twice a year. And the reason I say it's my favorite one is because we encourage parents to bring the children on their birthday. If you come on your birthday, just like adults, to go get your driver's license changed, check in, make sure it's not expired on your birthday. If you get kids into the habit of come on your birthday and then come on your half birthday, that's just healthy practices as you get into adulthood and you're on your own. When I'm working, I'm off that day, go see my dentist on my birthday. It's again, twice a year, see your dentist.
Very good. So Dr. Russell, is there a good age for children to start brushing teeth by themselves?
Yeah, so I recommend that children be assisted brushing up until the age of 7 or 8. Before this time, their dexterity isn't optimal. And a lot of times children will brush what they see. So they'll brush those front teeth, get those front teeth really well, but they're not getting their toothbrush in the back. So those back teeth are being neglected. So I recommend that a parent assist brush until about the age of 7 or 8, so that they're checking on how their children are doing brushing, but also ensuring that they're getting those back teeth for them that they're missing, that the kid is missing.
Very good. And then after 7 or 8, they just don't want to do it. So you still have to help them, right?
Yes,
Exactly.
well, actually, right. Through their adolescent years, really.
Right.
Dr. Fournier, how can our dental health as children affect our overall health throughout our lifetime?
Sure. Well, I already kind of alluded to this a little bit in terms of frequency of sugar consumption and how, especially sipping on sugar sweetened beverages can contribute to issues with childhood obesity, type 2 diabetes. But especially as we get older, there are a lot of correlations between what we call periodontal health, so gum health, and the structures surrounding the teeth, and overall general health. In terms of, we were talking about diabetes, there are lots of studies that show there's a correlation between good gum health and having good glycemic control and vice versa. There's also a lot of evidence that shows in pregnant women that if you have poor oral health when you're pregnant, you have an increased risk for problems with preterm birth and low birth weight babies. There's also chronic inflammation in the gums can potentially lead down the road to increased risk for heart attacks and strokes. So it's not just about cavities, it's about gum health. And it's interesting. I think a lot of times people equate brushing and flossing to cavity prevention, but the actual act of brushing and flossing itself is actually more for gum health. And the fluoride in the toothpaste is what helps with the actual cavity prevention. So you're getting a twofer there.
Good. So Dr. Beverly, back to you. Just a regular routine visit to the dentist, what typically will that consist of?
A routine visit cleaning consists of you arrive, and once the parents and the child are in, the first thing you always do, and so I'm going to give you what it consists of, but it can go in different orders, okay? A review of the health and medical history. That's very important to know what we're dealing with this particular child. We do a physical exam, then you do a dental exam, a removal of the plaque and tartar, which is called, your cleaning portion. Then you do your prophy club cleaning, which is called polishing, and you use the kids call it a little gritty toothpaste to clean their teeth. Next, flossing, rinsing, and a fluoride treatment, which is important to fortifying those teeth. You also, in that first visit, we do dental x-rays as needed and individualized for each particular child. You also do photos, good photos for records sake, and just visualization also too. And what I like to always, I guess the best part is now the conversation. The conversation we're gonna discuss with the parent, what we see, anticipatory guidance on what you should expect, what you should be doing at home. And also too with children, that conversation with older children, that conversation with them, okay, you're getting older, you need to be more responsible. And so once you do all that, that's a basic, I guess that entails most of, that entails the first dental visit.
Terrific. And Dr. O'Rourke-Allen, this is a question that comes up quite often. How often should parents replace their child's toothbrush?
Every 3 months is usually the base, usually what everybody recommends. But usually I would say, whenever you notice that the bristles are frayed, then you know that it's time to change. And then you have to really assess, is it fraying within a month? Because then we may need to look at the fact you're not brushing the way that you need to be. You may be brushing too hard. And you definitely want to use the soft bristle toothbrush in those circular motions toward the gums. So every 3 months, but like I said, if you notice when those bristles are frayed, it doesn't allow for an optimal cleaning. So every 3 months.
Terrific.
I just want for Dr. Fournier to do that again, because like, I think that that's important for people to see, like fraying means when they're like going like this, right? Doesn't mean dirty, doesn't mean turning colors. It really means like the configuration of the brushes, like they don't stand up anymore like this, right?
Right.
That makes a difference.
Absolutely.
Dr. Fournier, since we're going back on the preventive part, which I think is for the dentist here, we like prevention rather than fixing most days.
Absolutely.
Yes.
What can you recommend that families do between checkups to maintain healthy teeth?
Awesome. Okay, so there's a couple of simple things that I like to recommend, kind of trying to distill things down for what can we do at home. Couple simple things. One, decrease sugar consumption, increase fluoride exposure. So if we're going to have anything with sugar to eat, whether it's sugar sweetened beverages or candies, try and keep it at meal times. So breakfast time, lunchtime, dinner time, that'll give your mouth 2 to 3 hours to kind of flush away all of the acids that the sugar bugs make on our teeth. And if we're drinking water specifically that has fluoride in it throughout the day, the teeth are like a rechargeable battery, and they'll be able to protect themselves against those acid insults when they do happen. So that's number one. Number two, when we're doing oral hygiene, I usually recommend, I know Dr. Beverly mentioned earlier about flossing and brushing. I like to actually recommend flossing first so we don't forget, and that way it gets everything from the sides of the teeth out, and then we can brush it away. Then brush. I like to do 10 circles for each tooth, because sometimes kids will brush the back and then brush in the front, and they hold their lips together to try and hold all their studs in, and then their lips get really tight, and it makes it really hard to get the toothbrush where you need it. So spitting out a couple of times when their mouth gets full. But the important thing is to not rinse with water or really anything after brushing, because we want to keep the fluoride from the toothpaste coating the teeth. And that should honestly be the last thing that touches our teeth before we go to bed at night. And then lastly, like we were talking about before, if we are going to have snacks, try and keep them to be protein-based snacks, cheese, yogurts, nuts, beans, eggs, things like that. So again, it's all about decreasing acids, increasing fluoride exposure, and fluoride's best effect is a topical one. So when it's actually touching the teeth. Now your body is actually really pretty cool and resourceful, and it will kind of recycle the fluoride back in through the saliva a little bit. So that way it will actually help even when you're not drinking water.
Terrific. So I'm going to throw some curveballs at y'all. So whoever wants to answer these, feel free to jump in. Especially as pediatric dentists, you know, we do see some challenges at times when you may have the 3-year-old and mom and dad didn't know this information that we've given this evening. And unfortunately, little Johnny comes in and has cavities. And the first thing they're going to do is look at you and say, Doc, how do you think you're going to fix that on him? What are some of the options that you guys have in your repertoire to take care of this little guy or girl and not have them, as you just said, Dr. Fournier, hate the dentist for the rest of their life?
I think it kind of depends on the extent of decay, to be honest. If it's a small white spot lesion, like Dr. O'Rourke-Allen was talking about, and what that is, it's just a small area, usually along the gum line, that looks kind of white and chalky. Those we can monitor with doing the changes like Dr. Russell mentioned too, with diet and oral hygiene and increasing fluoride exposure. If it's a small cavity, there are some minimally invasive techniques that we can do. There's one option that came out on the market in 2015 called silver diamine fluoride, which is a cavity arresting medicament that we can easily paint on the teeth. It's non-invasive. It works great as long as we're doing all those other changes at home. And sometimes we can even do a combination, what we call smart restoration, which stands for silver diamine modified resin or atraumatic restorative technique. So basically it's a very simple white tooth colored filling, and it's a specific kind of material that helps remineralize teeth, because it again is like a rechargeable battery. The material takes in the fluoride and slowly releases it out into the tooth. But if cavities are more extensive, then there are other tricks that we need to employ. And as pediatric dentists, we have lots of tricks up our short sleeves. So they can range from simple behavior management techniques to kind of talk kids through a procedure, depending on what it is. We can employ the use of either laughing gas. Sometimes we have the options of oral conscious sedation to give kids some goofy juice so they just feel a little loopy, or they might not remember a procedure. But if it is more extensive, then there is a chance that we may have to employ the use of general anesthesia, which is a surgery, to complete all of the treatment, just depending on the extent of decay, taking into consideration the patient's medical history, like Dr. Beverly mentioned. So it just depends on the situation, but hopefully your pediatric dentist will be able to help guide you through all of the different options and what is the best thing for the child based on their assessment.
Terrific. And I think that conversation revolves around, we like the preventive conversation more than we like that conversation. So getting that infant in by that first birthday, I think Dr. Beverly did a great job saying what's going to happen. It's more of a discussion than anything at that first appointment, and that can lead to a lifetime of healthy teeth. So especially when we graduate over to Dr. O'Rourke-Allen, they have sealants and clean, healthy, straight teeth, and she's smiling and her life's good, and everybody's happy around here, correct?
Yes.
I guess I might have to get a loan from you all then. We don't have any cavities to fix. But no, that is definitely a great day.
Perfect. Does anyone else have any topics on mind that they would like to, ideas that they'd like to put out there, share information with some of the viewers that we have?
I'd like to actually ask a question. Of course, like I said, we're talking a lot of health disparities, health equity, and we all know that access is an issue, right? So I hear a lot of advice around making sure that we have healthier meals and healthier snacks. And a lot of people that are of certain areas within towns, they're in food deserts, they may not have access, they may not have a culture that even, wants to have that type of food. It just depends. How are we addressing those issues just from a variety of different health disparity, health equity ways? The access issue, the socioeconomic status, and maybe not having the funds to eat healthier all the time. I know I received snacks at some point when we first got off in COVID, we were receiving foods and meals and stuff, the boxes, right? There wasn't a lot of healthy options in there. And we're like, okay, well, we can stop this because we don't need that. This isn't helping us. So what are we going to do? What are we doing about that? What are we helping with that? Is any resources out there that we know of? How are we supporting those efforts? Are we connecting them to community organizations? Anything from any of you?
I guess the question, if we speaking more on a state level, they're trying to put more providers out there that's in those underserved areas, whether that be a rural area like Oakdale, Louisiana, or something like that, or having providers that's more accessible, even in the cities like Baton Rouge with extended hours and on Saturdays, and also too just being a little bit more flexible and compassionate with parents and their, they have strange hours of working, so being able to get them in quickly when a parent is off. So I think that's the access issue is one of those issues that's an issue with Louisiana and has been, but we're approaching it from different aspects.
Yeah.
I think a lot of it too, it has to do with education and trying to find ways to make our recommendations work for each individual family. At least that's something that I try and do in our practice. But in terms of education, I mean, just in talking about water, I can't tell you how many times a day I hear people talking about, oh, we drink bottled water. And then, for example, a parent brought in recently a Nestle Pure Life bottle, and looking at the label, it actually says taken from a public water supply. So I told them they basically take the city water, they put it through a filter that takes out 90% of the fluoride in it, they put it in a bottle, and they sell it to you at an increased price. So let's cut out the middleman. Let's just use the water from the refrigerator. That's only going to take out about 10% of the fluoride. So take all the money that you were spending on drinking that water, and let's put it towards getting some cheese or some yogurts or some apples. There are options out there that don't cost a lot of money. So if we can, take our resources that we do have and apply them in a way that will be a little healthier. I think sometimes it just takes time on our part as providers to help guide parents through those kinds of processes and realizing that you don't necessarily need it. I know somebody earlier talked about Gatorades. I swear that the companies that produce those kinds of sports beverages should get an A+ for convincing the world that they need electrolytes. And when I talk about patients about electrolytes, they tell me, oh, what I need electrolytes. Well, do you know what that is? Do you know that it's really just salt and sugar? And they're like, really? I didn't know that. And so again, it's just taking those 2 extra minutes to talk and to educate and to help guide through some of these thought processes. So if they do have an option, they will be able to help choose. Now, you mentioned food deserts, and that's a different story. There are oftentimes farmers markets that are easy ways to get quality produce at lower prices, kind of in bulk. So that's one resource that I usually like to recommend, but I know sometimes those times aren't always feasible for working families. So I can definitely look up to see if there are other resources for areas where there are food deserts. That's a great question.
And just to piggyback off of Dr. Fournier, the access issue, it is a concern. There are some problems. However, I feel that we are out there. I think patients and parents can become more educated in finding that dental home. There is somewhere for you to go to receive that education, and we're not being used enough. So access to a certain extent is out there. I just don't know if everyone knows where to go, but we are there. Find your dental home. That's a take-home point that I want everyone to know, that every child needs to have somewhere that they can go with if they do have pain or something like, or pain and preventive measures.
So see, Dr. Beverly, I'm sorry, I didn't mean to cut you off. I know you're out there in Baton Rouge, So I think in Baton Rouge, we have the access. In New Orleans, we have the access. I think that most of the dentists in the state of Louisiana are in the Southern Louisiana area. I think you're correct by when you were saying like your Oakdale area, you really don't have, per capita, you don't have a lot of dentists. And so maybe like Dr. Fournier, I was also a National Health Service Corps dentist, but I chose to do my loan repayment here in the inner city. Mm-hmm. So maybe we need more programs to attract dentists to those areas. Now, we also, whenever, as you heard, I went to Baylor College of Dentistry, but when and I think I'm maybe the oldest one here, LSU had 50 spots. So they're putting out 50 dentists a year. I don't know that has changed. And then we have the dental hygiene issue as well. You only, it's just sad. You really don't have enough programs there. So I think, on a political level, there definitely needs to be some type of legislation or whatever, all that stuff that the political folks do. That needs to happen to make some changes in those areas. And quite frankly, I would be remiss if I didn't say we need to look at the Medicaid reimbursement rates. The prices to run a dental office are exorbitant. They were exorbitant before COVID. Now they are just ridiculous. If you haven't looked at the price of gloves lately, you would cringe. And so in saying that, most people are getting a third of their usual and customary fee for those procedures. And I don't use any different materials on a Medicaid person versus my brother or anybody. So everybody's getting the same care, but we just need to look at that. I think that, we have a lot of dentists in Baton Rouge, but a lot of them do not take all of the Medicaid programs. And it's not feasible.
If I can add one other thing too, to access to care. I absolutely agree with everything that you all just said. I think one area that I've experienced where there really truly is a severe access to care issue is for our medically complex kids. For example, there are a ton of pediatric dentists between Lake Charles and New Orleans, and yet I can't tell you how many kids I treat from Lake Charles because they don't have access to a pediatric cardiac anesthesiologist to do their general anesthesia. And I mean, there's anything special about me and the care that I can provide versus any of the other pediatric dentists that are here, other than I am blessed to be able to work in an environment at Children's Hospital in New Orleans where I have such an incredible team that can take the best care of these kids. But I worry about all the kids that don't have the transportation to get to New Orleans from Lake Charles or Alexandria or Shreveport that we see on a very regular basis. So I wish that I could pack up my team and go everywhere, but that's just not feasible. So I think in that respect, we do have a severe access to care issue, and as well as for our older special needs patients. And I'm so glad to know that Dr. O'Rourke-Allen helps manage those kinds of patients, because I will definitely be referring patients to you when they age out, especially when they're from your area, because they just don't have anywhere to go. But they don't have anywhere to go. And for those patients, we do the best that we can until they age out of our practice, but we are oftentimes as pediatric dentists doing care that is more adult-based dentistry, but because we are really the only ones that have the extra training to work with these patients with special healthcare needs. So for those patients, I think there is a true access to care issue.
Thank you all for those answers. And Dr. O'Rourke-Allen, I think it was important for you to kind of talk about the graduate pool, right, of people that are coming out to be dentists, or slots that they have available. So not that you have all the time in the world, but there's also a Clinicians of Color program work group that is coming out of Louisiana Department of Health. So you can join that work group and give that. No, but even just writing into me to remind me to bring that up into the work group, right? Is that may be something that we need to fold in and think about, is to address the slots that are available for dentistry. That could definitely be something. We also will be having a parent leadership group. And so that may be something that parents may want to advocate for, that they have more dentists in their area, or, even dentists may work with some of the food banks or the faith-based communities that may provide food. And I know in New Orleans, there's a few neighborhood gardens that will give food away if they're, if you come in to help grow it and things like that. And so maybe just, work in those type of community resources and find a way to collaborate. But I think all of the information you all gave for that question was extremely helpful. So thank you so much.
Absolutely.
I also wanted to mention that I think it's important we get into schools, because that's where all the kids are. And a lot of times their parents don't have time, or they can't take off from work, nor take the child out of school to get them to the office. So I know some schools down in the New Orleans area are adding dental chairs in their schools. And they're also mobile dental buses that are going to some schools, so that children are getting less, educational time, and their parents aren't having to take off from work, so that these children can get these vital services that they're needing. So I think it's important that we get into schools, number one, to educate, but also to bring the resources to them as well.
Great. Well, ladies, thank y'all so much for giving us your knowledge and information tonight. Y'all a really special group. But we're going to one more question before we let you guys get out of here, and feel free to answer whatever order. But what's the one thing from tonight's conversation that you want parents to come away with?
I'll start. Just know that we're here for you. We are dedicated to our profession. We are dedicated to the community. And there are truly some very good people in the dental profession that genuinely care about your children, you, your parents, everyone. And we really will do what we can to help you. The dentist is all about money. No, we're not. We're really not. We are really about patient care. That is the ultimate reason that anybody in this profession is in it, because we genuinely want to see good outcomes. That's really the good outcomes.
And to add on to that is, again, find a dental home like Dr. Allen, someone that's caring, compassionate, willing to listen and understand and accept your family where you all are, and to, and if we need to bring you to a certain place, willing to do what it takes to get there. So my take home is find a dental home,
Mine as well. Establishing that dental home as soon as possible, especially by the age of 1. And if you haven't already, then it's time to go yesterday. And then also prevention is key, and making sure we're kind of monitoring and being intentional about the things that we're consuming, right? Because it's good for dental health and our oral health, but it's good for our overall health, and it directly affects our overall health. So, but establishing that dental home as soon as possible is the most important thing.
And agree with all of them about dental home, but I guess for take home points, I would also say water in between meals, anything sugary at mealtime, water with fluoride if you can, If not, then try and either brush or mouth rinses, as long as kids can spit in between meals are okay, as long as they have fluoride in them, to increase that fluoride exposure. And remember not to rinse with anything after brushing to keep the fluoride coating the teeth.
Great points, everyone. Thank you all so much.
Yes, thank you all so much. It was such a wonderful, informative conversation. We're so thankful to have been able to have you all on the call today. So thank you so much. So I want to thank again, Dr. Comeaux, Dr. Beverly, Dr. Fournier, Dr. Russell, and Dr. O'Rourke-Allen for being a part of this especially important panel discussion. As community gatekeepers and healthcare providers participating in this discussion, each of you has helped to enrich people, populations, and communities' awareness. So thank you.
Thanks for having us.
Thank you.
Appreciate it.
All right, so yes, we're going to bring up, we've already brought up those key takeaways that we mentioned prior to our panel discussion. So just to go over those one more time for everyone, getting up-to-date and accurate information from credible sources related to good dental hygiene, making sure to go to the dentist for routine cleanings regularly, as mentioned on the call during our panel discussion. Prevention related to understanding how the choices we make regarding adequately cleaning our teeth, what we eat, and more will eventually affect our dental and overall health. And last but not least, that oral health is essential to general health and well-being for all ages. I want to thank all of our attendees for coming and listening to this discussion. And I hope that you found this webinar enriching and valuable, and that you will take back and add to your discussion with your families and within your communities. Please utilize the resources that we will be emailing to you after today's presentation, including the recording of this webinar, our one-pager, which outlines the facts regarding pediatric dental health, resources that are available within Louisiana, and also includes a fun-related coloring pages for children ages 3 to 8 from the Centers of Disease Control and Prevention. We will also be sending one additional information resource that includes the long list of dental practices represented on today's call. So wonderful. And at this time, I will bring in the Director of the Bureau for Community Partnerships and Health Equity once more to close out our webinar. Devondra.
Thank you, Ayana, and thank you to each of the panelists today for sharing your expertise and knowledge. We truly appreciate for the service you do for all of our Louisiana residents. Before we go, I'd like to thank the staff of the Bureau of Community Partnerships and Health Equity and the entire Louisiana Department of Health team for supporting such a much needed conversation. We would like to also thank our fearless leader, Dr. Courtney Ann Phillips, for her continued leadership and commitment to creating a healthier Louisiana. Please join us for our next conversation focusing on colorectal cancer awareness, held on March 23rd at 5 p.m. You can use the QR code on your screen or go to tinyurl.com/LDH colorectal cancer web to register for our next webinar. This will conclude tonight's event. Good night to you all.
Good night.